Hey guys, welcome to my channel. This is your host Nakasha, mental health consultant and therapist. This channel is all about mental health. I'm going to be giving you guys tips on how you can be intentional in improving your mental health to achieve the vision you have for your life. In today's video, we're going to be talking all about depression. If you or someone you know is experiencing depression, or if you're a clinician looking for ways to support your patients, then this video is for you. First off, we're going to begin by talking about the symptoms of depression. From there, we're actually going to look at the nature and function of some of these symptoms. Then we're going to look at some potential contributing factors. Then we'll end off with talking about some tips for how you can deal with some of these symptoms you're experiencing. So first off, you may be wondering, how do I know if I'm depressed? How do I know? Well, before I get into that, let me just throw in this little caveat and say, just because you're experiencing depressive symptoms does not mean that you would meet the criteria for a diagnosis of depression. With that said, some symptoms of depression would be if you have noticed that you are feeling depressed in your mood, or you can say down, blue, for most of the day, each day. If you notice that you are experiencing what we call apathy, which is like a lack of pleasure in different things in your life that you used to enjoy. If you notice that you're eating too much or not eating enough, like you don't have much of an appetite. If you're oversleeping or not sleeping enough, or even having a poor quality of sleep. If you've noticed that you're experiencing a lot of fatigue, so that would be a loss of energy. If your motivation to do things and accomplish things is quite low, if you have this sense of worthlessness or this feeling of guilt that just stays with you. If your concentration, your ability to focus is quite low, or you find yourself very indecisive, if you're having a lot of thoughts about death or suicide, or if you have a noticeable slowing down of your thoughts and your physical movements, and this is something that's even observable to others, these are some indicators that you may be experiencing depression or at least depressive symptoms. Now, looking at fatigue, you're feeling depressed and you're finding yourself tired throughout the day. Fatigue may be the result of insufficient restful sleep. So maybe you are sleeping, but if that sleep is not restful in nature and its quality, then you may find yourself tired when you are awake. Well, what about those who find themselves sleeping a lot more when they're depressed? Well, excessive sleep can mean that your body will begin to release melatonin inappropriately, which could actually result in poor sleep quality or fatigue when you are awake. So you're sleeping a lot more, but you're finding that when you're awake, you're still pretty tired. Hopelessness and helplessness. That is a common symptom of depression. So chronic pain, fatigue, excessive demands, using substances that act as depressants, unhelpful thinking, all of these things contribute to that sense of helplessness and hopelessness. So let's look at apathy. That sense of not really being able to get as much pleasure out of different things in life that we used to. So in the stress response, our HPA axis releases things like cortisol, adrenaline, norepinephrine, all of the things that are needed to help us fight, flight, or freeze. And in doing that, it's not really focused on pleasure, which could be basically what causes or leads to that symptom of apathy. Reduced libido. Some people may find that when they're feeling stressed, depressed, anxious, then their libido, their sex drive is reduced a little bit. So when we are in the stress response, estrogen and testosterone are reduced. If we're focused on survival, then procreation pretty much takes a backseat. However, that reduction in estrogen and testosterone also means a reduction in serotonin, which is the chemical that helps us to regulate anxiety. So that learned helplessness symptom may begin to set in. Also, less serotonin means less melatonin, which is the hormone that helps us to sleep. So whenever I have a patient that comes in with concerns about depression, I always recommend to him or her to see their family doctor. And it's really important so that they can kind of rule out any physical contributing factors that may be at play. Now, looking at the physical factors that may be contributing to depression, it could be things like vitamin D deficiency. You know, we need the sun even for our moods. There is hypothyroidism, chronic pain, diabetes. Now it's important to remember that diabetes does have symptoms that are similar to depression. Some prescription medications, substance abuse, caffeine, stimulant, sleep apnea, nicotine, pre-workout supplements for fitness buffs, that's important to know. And alcohol. Although alcohol is a depressant, it can begin to cause anxiety as it leaves your system. There are some other psychological factors that can contribute to depression, such as grief and trauma. Those are some big ones to be aware of. Also trauma, if you've experienced a recent trauma or you have a history of traumatic experiences, then those are things to be aware of that could be causing depression as well. So it's important to be aware that there are things that make us more vulnerable to stress. We call them stress vulnerabilities. So those are things like sleep, nutrition, physical activity, physical illness or pain, grief. Now in the part 2 of this video, I'm going to be giving a brief overview of different tips and tricks to deal with depression and depressive symptoms. Now keep in mind that this is just going to be a brief overview, but as time progresses, just keep an eye out because I am going to be making more in-depth videos on each intervention approach that you can use to start to lift some of those symptoms. Now, if you find that you're starting to feel depressed, it's really important to figure out what your triggers are. Now, you may not know right away, so it's actually helpful to sometimes keep a log of it. We're just basically figuring out, are there certain people, places, things, situations that are triggers for you, that triggered those depressive symptoms? If you know what your triggers are, then you can start putting a plan in place to mitigate them. A lot of times we actually have far more coping skills, tools than we realize. So it's actually helpful to think about in the past when you faced a major stressor or difficult situation in your life. What worked for you then? What did you do that helped you get through it? Even on a day-to-day basis. Let's say you're feeling really blue, you're feeling really depressed. What do you do sometimes that actually helps you lift that mood, even if it's just for a little bit, or helps you just get through that difficult period? What are some things that have worked for you in the past? It's easier to do things that you've already been doing and that's been helpful for you than choosing an entirely new strategy. Another tip is to incorporate at least one activity that you enjoy into your day or even your week. Schedule it in and commit to it. Choose a small block of time that you can commit to, because keeping it small will also ensure that you can follow through even when life gets really busy. One way to deal with the symptom of hopelessness and helplessness is to shift your focus to what you have control over. Take small steps towards your goals. So each morning when you wake up, you can ask yourself, what are 3 things I can do today to bring me closer to achieving my goals? Again, keep them small. So kind of keeping in line with the idea of incorporating something you enjoy into your schedule is creating a schedule that includes one activity for something that you enjoy that feels good, but also an activity that allows you to relax, because this can actually help deal with the symptom of low motivation and sense of hopelessness. Now let's talk about exercise. It can be helpful to think of exercise as a natural antidepressant, anti-anxiety treatment, because when we exercise, it releases those endorphins that leave us feeling good and boost our energy. Exercise doesn't even have to be intense or lengthy. Let's say in a week you did 2 to 2.5 hours. That's still pretty good. It could even be something as simple as going for a walk. All of that's helpful. Now, social connection. I cannot express enough the importance of social connection. Having a connection, quality relationships to others can actually boost our immune system function. It gives us that sense of belonging and wards off feelings of loneliness, which is quite a common symptom with depression. So when you're feeling depressed, it's pretty natural to feel like I want to socially isolate, I want to withdraw from others, but do the opposite of your emotion. As much as you want to withdraw from others, it's actually really good to then start to connect with others, those who are supportive, those who you have positive interactions with. Just connect with others as much as possible. Now, one of my favorite tips for dealing with depression, any sort of stress or anxiety, is actually deep breathing. Deep breathing is a powerful tool for stress reduction. By using deep breathing, we're actually able to interrupt the stress response, which releases the hormone cortisol. Cortisol is harmful to our bodies if it's frequently being released. Deep breathing also lowers your blood pressure, amongst a host of other health benefits. Now, one of the things I hear from people a lot is, why do I need to do deep breathing when I breathe all the time? Now, deep breathing is not like your normal day-to-day breathing. To help people kind of ensure that they're doing it effectively or properly, I typically suggest doing it while counting to 4. So you're inhaling through your nose for 4 seconds. You're gonna hold your breath for 4 seconds. And as you exhale, you're gonna count for anywhere from 4 to 6 seconds actually. And so it's going to be a very slow, controlled breath using the count to help you. Now, one of my other favorite tips is progressive muscle relaxation. I'm also going to be releasing a video that actually guides you through progressive muscle relaxation. There's also lots of scripts online, but that video is going to help you to actually use it and practice it together if you're feeling stressed until the point where it gets natural and you feel like you no longer need a script. Now, PMR teaches you how to recognize the tension in different muscle groups while also teaching you how to relax them. Now, it's really important to be able to detect the signs of distress in our bodies, like muscle tension, which is one of the common ones, because if we know how to detect them, then we're able to induce relaxation early on in the stress response. And I'm going to be making another video kind of going more in depth about the stress response and how to interrupt it, especially for those who experience panic attacks. Now, relaxation techniques like PMR not only reduce stress and elevate mood, but they also improve sleep quality and reduce physical pain with consistent practice. Sleep. Getting lots of sleep helps to keep our circadian rhythms stable. Circadian rhythms support our sleep, wake, and eating cycles. Now, when your circadian rhythms are not balanced, you may find that you're not getting quality sleep, you're tired when you're awake, and it can throw off your eating pattern. Now, if you're having trouble sleeping, one tip I would recommend is to create a sleep routine that incorporates the same activities each night, which can then act as a cue for your brain that it is time to go to sleep. I'm also going to be creating a video on sleep hygiene for those that are having difficulty sleeping, so keep an eye out for that. Now, for some people, it may be helpful to avoid daytime napping, but if you have to nap, just try to keep it under 45 minutes. Another tip is to avoid blue light. So that's the light that comes from our cell phones, our computers, our TVs. I know that can be hard, but it's actually very helpful if you're having sleep difficulties to avoid using that for at least an hour before going to bed. Now, for feeling low energy, so we talked about exercise already. Physical activity is a great one for dealing with low energy. Another one is to drink lots of water. When we are feeling dehydrated, then our bodies will be low in energy. Now, last but certainly not least, my absolute favorite is psychotherapy. Now, psychotherapy is something that you can receive through the aid of a professional, registered mental health clinician. There are many different psychotherapies out there, but the goal around them is to help you to process and reframe any unhelpful thought. Now, one of my favorite forms of psychotherapy would be cognitive behavioral therapy, or CBT for short, and I will be making plenty of videos about that. CBT is an evidence-based form of psychotherapy, which basically means that it's supported by research, and research actually considers it to be one of the most effective forms of psychotherapy for a whole host of mental health concerns, including depression. So if you enjoyed this video, please let me know by liking it and hitting the thumbs up icon. Also, please don't forget to subscribe. Make sure your notifications are turned on with the bell icon. That way you are notified as new videos are released. If you have any questions, please post them in the comment section below and I will do my very best to answer. I'm also very interested in ideas for upcoming videos, so if there are any topics that you want to know more about, please feel free to post those below as well. Okay guys, thanks for watching and I will catch you at my next video.